June celebrates Pride Month, and here to tell us how Niagara Health is putting people first is diversity specialist Lydia Collins. Lydia, what does it mean to provide a culturally safe environment at Niagara Health?
Yeah, at Niagara Health, our focus is really providing an inclusive, safe, kind, inclusive environment where folks can feel comfortable walking in our doors, like they can show up as their authentic selves as well, and really just feeling like they're being treated with the dignity, respect, and care that they deserve.
Now, your role is to help internal staff educate, right? That's a big word, educate.
Yeah.
And I'll tell you something, when I was learning about this, there's so many variations of how you learn, right?
Right.
For example, I didn't know what the acronym was before I would call it LGBTQ. Really didn't know, but the proper term is 2SLGBTQ+, right?
Perfect,
So
yep.
Can you give me a little more about the education piece?
Sure. So in regards to the acronym, again, like I mentioned, it's kind of one that historically has started off quite small and has grown over the years as we've recognized more and more diversity among gender and sexuality. And so, again, when it comes into that education piece, specifically in my role as the DEI specialist at Niagara Health, a lot of that has to do with supporting our staff. That is a trickle-down effect that, of course, helps with patient outcomes. But for me, in my role, I'm specifically focused on providing staff with the resources and support and education that they need to ensure that they can support each other as staff and create that inclusive culture and environment, but also support patients as well. And so some of the education includes every person that comes into our team and to our organization receives new hire orientation, which includes diversity, equity, and inclusion training. And that also is something that they take on throughout the year as well. So we have refreshers throughout the year. We have, folks are able to reach out to me directly if they want specific programming for their unit as well. And so constantly always kind of looking at new ways that we can provide even more training than what we already have. But that workshop, education, resource development piece is really, really huge for us.
Now, your role is new at Niagara Health, and that's because Niagara Health was really focusing on, it had a pillar of putting people first. Sure. Is that right?
Yeah. And so this role has actually existed for about 3 years. But again, that's still in the grand scheme what I would consider kind of a little bit newer, right, for our organization, considering how long we've been around. And so, again, our big strategic pillar is putting people first. And so in doing that, in my role, being able to have myself, be able to have our DEI committee, and be able to have folks who are really designated to supporting our staff with building capacity around subjects, including on the topic of diversity, equity, and inclusion, is really important to us.
Now, staff at Niagara Health can benefit by attending some lunch and learns, is that right?
Yes, definitely. And so actually we're obviously in Pride Month right now. And so we have a few coming up for Pride Month specifically. And so tomorrow actually we have one with someone named Lyndon George, who's going to be focusing on the 2S and 2S LGBTQ+, which is Two-Spirit identity, which is an indigenous gender identity that they've practiced for many, many years. And then the next one will be happening next week, and that will
which you're hosting, is that right?
Yes. So I'll be hosting that one. Then
people are interviewing you, right? Like, it's a little different, right? Like, we're turning the tables here.
Yeah. So for the one with Lyndon, I'll be fortunate enough to be able to be having that conversation with him, kind of like an open conversation, and asking them a few questions, and then the following one will be focused on me, so I'll have another facilitator asking me some questions.
Now, just for the viewing audience at home, what's your background?
Yeah, so professionally, my background is actually in healthcare, but not in this particular way. So a lot of my healthcare focus has been through community health. So I've spent a lot of time over the years working throughout Canada, specifically in Ottawa, and St. Catharines as well, working in nonprofits, community health organizations, really focused specifically on community health for diverse ranges of people, but also a lot of focus on sexual health and HIV prevention.
And one thing we forgot to mention, Niagara Health staff will be getting some free Swag.
Yep.
Is that right? People love the word
Yeah,
free. Tell me
yeah.
about that.
You don't, no quotations. It is free. It is. I promise. Yeah. So we do something throughout the month and throughout many months that we celebrate called rounding. So it's really an opportunity for us to kind of put some free swag on a cart and walk around to the different units on our sites, at all of our different sites, and be able to just kind of have clinical staff and frontline staff have an opportunity to break up their day a little bit by, you know, engaging with us and having some conversations, being able to pick up some free swag. We recently were rounding yesterday at our Niagara Falls site. We had chocolate, of course, everyone loves that. So just being able to also, you know, give out resources, and just really show that care and appreciation that we have for our staff, and while reiterating the importance of diversity, equity, and inclusion for us.
Very quickly, tell me, how does training Niagara Health staff on diversity and inclusion get back to the patient?
Yeah. So again, it's that trickle down effect, like I mentioned. Being able to pour into our staff and to allowing them to receive education and information and resources allows them to better support patients. So when they have resources on, you know, better understanding gender inclusive language and things like that, questions that I get asked by them often, it allows them to be able to take those tools and provide it directly to their patients. And so it really is, at the end of the day, everybody at Niagara Health, our focus is patient outcomes, even for those of us like myself whose roles are specifically focused on staff to staff education and development. And so, yeah, it really has that trickle down effect of being able to bring staff the tools that they need to show up their best as providers of care.
Lydia, happy Pride Month.
Thank you so much. Happy Pride Month.